Hi there, welcome to my channel, and we'll be dealing with mental illness.
Today's topic is depression. Remember our slogan, protect your mental health. It will be good if you go through the introductory video to this channel, as that will give you an overall insight into what you should expect. With that said, let's move. Questions that we're going to be answering: what is depression? Causes, symptoms. Well, it's normal to feel sad in times of adverse events, but when it becomes persistent and uncontrollable, that poses a problem. So we're going to be talking about all of that. Please be patient. Thank you. Depression is a mood disorder in which there is a persistent feeling of sadness that can interfere with daily activities. This can go on for weeks, months, or more, years, a lifetime if left untreated. Very common, even said to be the commonest mental illness. I guess that's why I chose it to be my first topic of discourse on this channel. Mean age of onset is 27 years, twice higher in females than males. It can originate out of the blues, or specific causes can be identified. And those identifiable causes we're going to be discussing next. Social difficulties, you name them: unemployment, divorce, loss of a loved one, etc., etc. Makes sense, right? Early upbringing, poor parental care, child abuse and neglect, postnatal depression, where it affects the mothers, but it can transfer the frustration to the children and the spouse too. Psychological, looking at personality disorders, temperaments like melancholic, choleric temperaments can predispose to bouts of depression. Genetics, increased risk in family members, especially first-degree relatives. So when a family member has depression, there's increased risk of another family member also having it. In other words, the closer the bond, the closer the risk. Brain disorders. On brain imaging, some structural abnormalities can be seen, like decreased brain volume, enlarged ventricles, altered blood flow, and metabolism. Hormonal imbalance. In some cases, you see decreased central nervous system hormones that improve the mood, like serotonin, noradrenaline, dopamine, and increased levels of hormones that repress the mood, like stress hormones and glutamate. Health problems like cancer tumor cells release depressogenic substances like cytokines and stress hormones that repress the mood. Now, we'll discuss the symptoms. Do you have low moods in the early mornings, which improves as the day goes by? Does this happen to you? Do you have sleep disturbances where you sleep a lot or you find it difficult to sleep? Do you have daytime fatigue? Do you suffer decreased energy and activity? Do you have negative thoughts of yourself, the world, and the future? Have you lost interest in previously enjoyed activities? Do you have decreased level of concentration? Do you have low or ravenous appetite? Any of these extremes? Do you suffer from low self-esteem, feelings of guilt, hopelessness and helplessness? Do you have thoughts of self-harm and suicide? Then you probably have depression. Join me on the next video where we'll be talking about complications and treatment of depression.
Thanks for watching. Don't forget to like, comment, share, and subscribe.